Good evening, everyone. Let's start our every evening Agrawal class 5 to 6, continued since 10th of April, Henry's birthday 2020. So, we were studying about the concept of vital force in respect of health, in respect of disease, in respect of death, in respect of cure. We completed the dynamic concept of health. We completed a dynamic concept of death. We completed dynamic concept of illness, and we were talking on the dynamic concept of cure. We discussed aphorism number 16 last evening. In that, it is some 5 points which he covered. The most important one is that we know that our vital force, which is dynamic, can only be influenced by the dynamic forces to deviate it, to derange it. Since it is a dynamic status of disease, the medicine required for that condition is the same that dynamic medicines can only influence. How does this dynamic medicine influence? How does it uh, contact with the vital force? The interfaces are sentient nerves, sensory nerves, or nervous system. That is the interface between the medicines and the vital force. And in that way, what is it going to do? It is going to correct that derangement, and simultaneously, this correction in the derangement of the health will be reflected in the functions that which were altered, which were disharmonized, gets all right, gets harmonized. Hence, health is back. So this we discussed yesterday. Now, let us go ahead with aphorism 17, which has got two footnotes also. So straight away, let us start with the aphorism 17. Now, as in cure, affected by the removal of the whole of the perceptible signs and symptoms of the disease, the internal alteration of the vital force to which the disease is due, M dash, consequently, the whole of the disease, M dash, is at the same time removed. It follows that physician has only to remove the whole of the symptoms in order at the same time to abrogate and annihilate the internal change, that is to say, the morbid derangement of the vital force and dash consequently the totality of the disease itself. But when the disease is annihilated, the health is restored, and this is the highest and the sole aim of the physician who knows the true object of his mission, which consists not in learned sounding writing, but in giving aid to the sick. So, in a very, very simple words, here in this aphorism 17, Master Hahnemann is teaching us that whatever you are doing as a physician, what exactly is the job of the physician here for the operations of the cure? What physician has to do? What is the task of the physician? This is the aphorism which is clearly telling about the task physician has to perform. He only has to perform that, perceive the totality of symptom and find out the right indicated remedy on that basis, give it, and as soon as that totality under the influence of the indicated remedy goes away, the mission of the physician is achieved. Again, he is again, in this aphorism. connecting us with the aphorism 1. As I told you many times, he Hanuman does not want that we should forget our mission. That is the most important point to keep in the mind. Now, let us go a little more inside the aphorism. So, read it like this. He says first the word now. It is same that if you remember aphorism 6, we studied after that when we started with the aphorism 7. The aphorism 7 again starts with the word now. Now, here he meant that in the aphorism 16, I made you understand that dynamics can really be in tune with the dynamic. Dynamic disease means the dynamic derangement can only be corrected by dynamic altering powers of the medicine. And how does it work? He told by the nervous system. And what effects it is going to produce, he told that in the aphorism 16. Once you are knowing this much, you are knowing the science so far as known to Hahnemann in those days. He told us the science of the operation of cure in aphorism 16. After knowing the science, he says now. You are understood now. Now, what you have to do? Now, as in the the cure effected by the removal of the whole perceptible sign and symptoms of the disease, the internal alteration of the vital force to which the disease is due, it follows that the physician has only to remove the whole of the symptoms in order. So he says now, as in the cure effected by removal of the whole perceptible sign and symptoms of the disease, now as in the cure effected, how cure will be effected? By the complete removal of sign and symptoms of the disease, the internal alteration of the vital force, which is nothing but the internal alteration of the vital force, to which disease is due. Consequently, the whole of the disease is at the same time removed. He is just repeating what we studied in aphorism number 16. He is saying that cure is effected when you remove sign and symptoms. That means the internal derangement is also gone. And that is nothing but the whole disease from the external expression and the internal derangement. Both. The external expression is of nothing but the internal derangement. And this internal derangement can only be understood by our senses in the form of signs and symptoms. And with the indicated medicine, when you're watching, you're perceiving that signs and symptoms have gone. But in fact, we understood in the aphorism 16 that the dynamic medicine, first of all, rearranged the vital force. And that is why completely this has completely gone, all the signs and symptoms. Once those signs and symptoms gone, now in that condition, the internal derangement also gone. And all this is due. Consequently, the whole of the disease is at the same time removed. It follows that the physician has now, in this complete operation taking place, what physician has to do? The physician has only to remove the whole of the symptoms in order. He has to just see all those symptoms which are there in the expression the physician's job is to understand those signs and symptoms with the senses, and his job is how to remove them in the order. And when the all the symptoms, whole of the symptoms are removed in the order, that means what? That means when he says at the same time, what is the meaning of it? At the same time means it means abrogation of the disease. What do you mean by abrogation? Abrogation means abolishing the disease, complete removal of the thing, and annihilate the internal change. The again, he is using the two words abrogation and annihilation. When you say abrogation, it is the external signs and symptoms which are abolished. When you say annihilation, the internal change. Annihilation means to rooting out something. That means the internal derangement also gone. That is why he used two words, abrogation and annihilation. Abrogation is about the removal, the complete abolishing of the signs and symptoms. And when you say annihilation, annihilate means to remove. Again, the meaning is the same, but then annihilation means rooting out, removing something from its roots. Where are roots? Roots are always inside. So it is the internal derangement that is also gone. So he says the only job for the physician is to perceive the symptom and remove them in their order. And once this is removed, in that condition, what is going to happen? Complete abrogation and annihilation is going to happen. That is to say, I mean to say, he says, the morbid derangement of the vital force, consequently, the totality of the disease itself, ultimately means what? I mean, the complete disease is gone. It is no more there, whether outside or inside. So, the whole the disease itself is completely abrogated and annihilated. This is one sentence. In the second sentence, he says, but when the disease is annihilated, now he is using one word annihilation because he says, now you understood what is the meaning of annihilation. When annihilation takes place, abrogation also occurs because annihilation means the removal of the root of the disease. That is the internal derangement correction, which is being done. When it is done, it is automatically simultaneously seen that outwardly symptoms are also removed. Abrogation is done. So he used here only one word, annihilation. The health is restored. Now, all those alteration of the functions have gone. That means, again, Aphorism 9, the harmonious flow of the all functions of the organism are back. That means health is restored. And what is the purpose of the physician? That is only the purpose. This is the highest and the sole aim of the physician who knows the true object of his mission, which consists not in learned sounding prating. What is this learned sounding prating? Means बात बच्चों वाली दिखाना ऐसे जैसे पता नहीं कितना ज्ञानी है. Learned sounding prating. Prating means a kind of babbling of a child, a childish talk. But the expression is what? The expression is as if what a learned talk he is doing. So it is just a shown expression that it is how learning talk he is doing. But it is not really that learning talk. Rather, it is a childish talk. As the he is indicating all this towards the old school of his time. And but in giving aid to the sick. But means all those talks, learned, so-called learned talks, but does not really giving any kind of support, aid, health to the sick. So ultimately, this whole aphorism 17 is mainly targeting to us, to physician, by the Master Hahnemann saying that you just better be clear about your job. What is your job as a physician? Your job is to understand the totality, remove the totality. The rest of the work is by default. It happens, you're not to do anything. You only do this much. You only simply take down of the totality of symptom, give indicated remedy, and just keep watching how these symptoms are going away in their order. Once they are gone, all those symptoms gone means that not that outwardly expression gone. The inwardly alteration has also gone. But for that, you are not to do anything. You are only to understand sign and symptoms. And once you do this, a very, very simple, easy job, your mission is achieved. What is your mission? Mission is cure. Know what is not your mission. He completely written the aphorism 1 and the footnote of it here in these 2 lines, that achieve your mission by doing this removal of the totality, and do not talk something sounding very learned but a childish talk. And this talk is not going to help any sick human being. So better work, not talk. Or we can say, Henman meant walk the talk. What you're talking must be seen at the bedside, must be observed at the bedside. Homeopathy this, homeopathy that. But patient is not healed. It is not walking the talk. Our job is that we are to learn how to understand totality, how to find out the indicated remedy, how to watch that in what order these symptoms are going away. And once this is over, you should be, first of all, you as a physician should be sure that not only symptoms have gone, along with that, the internal derangement has gone. Now, you can just take some examples for just give you some few examples, like with the cases. There are so many patients coming, and because of their maybe pains, maybe some GIT disorders, or maybe whatever complaint he has come to us, but then somehow he is not getting sleep. You have given the indicated medicine. He not only felt better in the symptoms, whatever it was, whether joint pain or GIT upset, whatever, but then he is able to sleep well. You and me, we never give any medicine which is inducing the sleep. It is out of the comfort he got, he is getting the sleep. And it is nothing but the most natural way of giving somebody the pleasure of sleeping. And I think you and me always tell our patients that we don't have any medicine to make you sleep like some kind of sleeping pills. It is out of the relief, out of that salutary effect of our medicines, you feel healed. You feel inside healed up, led to this kind of change that you feel good in your appetite. You find such a good and pleasurable sleep. So you have not induced it. So this is what is being observed, and that is what is actually the correction of the altered functions. And once this altered functions has been achieved, the cure is taking place. Cure has taken place. And once this is taking place in a case, you are very sure that I have not given any sleeping pill. Once patient started getting his natural sleep, and once patient started getting his natural appetite, does it not mean that anything disturbed inside, anything deranged inside has become all right? If you want to be more sure, I would suggest you to get guidance physiology book and read the physiology of appetite. Read the physiology of sleep. Read the physiology of making urination. Read the physiology of getting the formation of the stool. All these, what we generally call in homeopathy as the physical journals or the generalities of the patient. Why they are generalities of the patient? If you go in the physiology, you will learn it better that even if we know so much about the physiology, we are unable to tell how this appetite is felt. And once you have taken a food, immediately, immediately you feel filled up. That sense of I am hungry has gone. How that when you take the desired the quantity of the water, suddenly you find that pang for the thirst has gone. We do not know in physiology how it is happening. Even if the natural movement of the bowels, how does it come back with the right medicine? We are unable to explain because we exactly do not know about the right physiology of the making of the stool, the bowel movement. So we are still in so many of such physical journals are still in gray light. May not be complete dark, but then definitely the gray area. We do not know how all does it work. So point is to understand that how all these things are really changing with the medicine. Though it is but just nothing energy, the dynamic medicine. So look at the job, the very, very specialized job a homeopathic doctor does, getting to know the whole history of the case, out of that, completely digging out that totality of his disease or the totality of the patient as a whole, and getting that indicated remedy to remove this on the basis of law of similia, and then following how the disappearance of the symptoms are occurring in the order to watch that it is going in the right direction. So this very job can only be completed if we learn that main task, main methodology of understanding the totality and finding out the corresponding indicated remedy for it. And once you do this much is only the physician has to do. Rest is a job which is being done by default. You are not to do anything else beyond this. Rest is by default. Rest is by itself. It happens, you are not to do anything. And what is the outcome? That mission is achieved. What is your mission? Cure. And so, this is the understanding we should be keeping in mind. And there are two very, very important footnotes. The first footnote is at the same time removed in the fourth line, it is there. What is this footnote is talking? This footnote is talking, it is just giving an example to all of us that how diseases are dynamic. This footnote tells us That suppose, because of some reasons, one human being, one person believes, yes, of course, false belief, believes that this is now, time is coming very close that I am going to die. He gets this false belief that my death is going to occur. With this imagination only, the internal systems of the body starts enfolding everything and the signs of death starts appearing. So how can it be something materialistic of the disease? I told you to find out and go through the signs of the death. There are some 10, 11 signs of the death. You can find out if you try to Google it. You'll find some 10 signs of the death. I just tell you. They are: sleep more, decreased appetite, less social, changing vital signs, decreased body waste, cool skin, muscle weakness, labored breathing. All these are nothing but related to the signs of death, and maybe more. So, when somebody is getting such kind of signs, you can make out that death is nearby. And so far, I am reading about all this. I am finding, if you are quite conscious enough, some 6 months before these signs starts coming. So the most important thing for any physician is to be aware in somebody these 10, 11 points and maybe more. If they starts appearing, the case, whatever may be the name of the disease, but the case is very serious. And in that, one can find out if he has a false belief that my death is imminent, I am going to die. So one point to learn out of all this is, in the person, those who are not really ill, sick in any kind of disease, like he is not suffering with hypertension, he is not suffering with diabetes, he is not suffering with any disease, only because somebody suggested and made you to believe that your death is coming, and you believed it. Out of this false belief, even this is a false belief, but then this belief has got such an impact that you will start showing all those 10, 11 signs of death. This is the power of imagination. Where is material in it? There's nothing material in it. This is the first learning out of it. And now, when it is a dynamic state, dynamic condition of the person, some dynamic inimical influence, some kind of suggestion, harmful suggestion, that I'm seeing, I'm your Guruji, and I'm seeing that in couple of days you're going to die. And having that faith, the culture we belong to, we trust our Guruji beyond doubt. And when he says, it is God's words. And you start showing without any reason all those signs of death. This is the power of imagination. So in that case, what should be the treatment? Again, the treatment should be of similar nature. and in this way, dynamic only must be affecting on your thoughts. So you are to play some kind of game, some kind of deception. Maybe you are utilizing something wrongful act for that. But the purpose, the mission is to remove this delusion from that man. So all those things comes under the psychotherapy. And this psychotherapy and whatever the therapies you name it, it is called, according to homeopathy, according to Hahnemann, according to Aphorism 17 footnote, moral remedy. You are treating this kind of moral conditions with the moral remedies. This is the basic gist of this aphorism. I just now read it for you so that you may understand it very well. The aphorism footnote goes, the first footnote goes, a warning dream. What are the causes you may believe? You may have the delusion that I am going to die. It may be a warning dream. Then a superstitious fancy. I told you, sometimes we are so superstitious, Guruji told, you're going to die, ho gaya kaam. Or a solemn prediction. Some Panditji told you, this is going to happen. Superstitious fancy. I recently got a case. That man, he went to his. We are having so many of gods. All are one, but then we all are having that in our house, in our complete clan of the family, we trust that particular goddess. That man went to his village to pay respect to his family clan goddess. So, out of the respect, he took some garlands and offered to the deity. But somehow that garland fell off. And he started crying that my goddess is now angry with me. She did not accept my garland. And that really worked so much that he was becoming very sick. And he is a highly diabetic, and so much of hypertension he is carrying with him. Then suddenly his wife, she acted in such a way that that goddess has come within her, and out of that kind of expression that she herself is a goddess, and admonished him, rebuked him. I'm not angry. You are not getting me correctly. I am very happy. I am giving you this and all those things. And that next moment, that man became all right. So this is a superstitious fancy. Solomon prediction that death would occur at a certain day or at a certain hour has not unfrequently produced all the signs of commencing and increasing disease, of approaching death, and death itself at the hour announced, which could not happen without the simultaneous production of the inward changes, inward change corresponding to the state observed externally, and hence in such cases all the morbid indicative of approaching death have frequently been dissipated by an identical cause, by some cunning deception or persuasion to a belief in a contrary, and health suddenly restored. See, this is the example I quoted you. As soon as those signs starts appearing of the death, and you play some kind of mm, cunning role, deceptive role, you just pursue them. She persuaded him. He that lady, that the wife persuaded her husband in such a way that suddenly that superstitious feeling has completely gone and started to become all right. So, what do you mean by cunning? When you say cunning, when you say that you are very smart, that means a kind of cunning act where whatever you are not, you're trying to make somebody believe with very smart words. Those smart words is a cunningness. So that kind of smartness that wife played and saved her husband. Why? Because that as soon as she told that I'm happy, I accept your garland and I give you everything. That started giving a effect, that is the dissipation, the evaporation of those emotions. Suddenly that man felt that my goddess is angry with me, and he felt very sad and started showing so many signs of the disease and weeping and everything. They started suddenly dissipating. Dissipating means evaporating. धुआं होने शुरू हो गया. Why? Because the wife, she played the identical cause. She herself became the goddess. And he was telling me here very happily that my goddess came before me live. This is called moral remedy. To by some cunning deception or persuasion to a belief in the contrary and health suddenly restored, which could not have happened without the removal by means of this moral remedy of the internal and external morbid change that threatened them. So, what is the learning of this example? That having those signs and symptoms of the expression that death is coming outwardly, they cannot come without the changes inwardly. I told you some 11 sign in that all those physiological changes occur. Your discharges become less. Your heart works in different way. Your breath becomes less. You start getting less breath. You start sleeping more. You start eating less. You become socially cut off. Like this. So many things are happening in that. So this is how we find that this moral remedy concept gives us so much of teaching that even thoughts can make us sick. Requires a identical thought to correct it. So this is something very very important for every one of us to learn, right? So in the footnote 2, which is there at the end of the first sentence, disease itself, footnote 2. What is this footnote telling? This footnote is telling us that Henman is giving credit to the God, that thank you very much. You have given us one window that the internal derangement is simultaneously expressed in the outwardly signs and symptoms. And they are the sole guide for really curing a human being. Suppose if God has not really given this window of showing the internal derangement by signs and symptoms, what would be the status in that condition? What would be the condition? Would we be able to cure anybody? we will not be, we would not be able to cure anyone. This is the footnote. He is quite thankful to the Almighty for offering this award of knowing the inward disturbance, inward derangement of the battle force by simultaneous signs and symptoms. How he goes in the footnote 2, he says, "It is only thus that God, the preserver of mankind," P is capital. So the preserver of mankind is indicating towards the God, could reveal. You will see his, he, all are denoting with the uh, capital H. Preserver of mankind could reveal his wisdom and goodness in reference to the cure of diseases to which man is liable here below by showing to the physician what he had to remove in diseases in order to annihilate them and thus re-establish health. This is the one sentence. He says, thus God, this preserver, could reveal his wisdom, that is the goodness in reference to cure of the disease to man is liable here below, by showing to the physician what he has to remove. He has blessed us by just guiding us that what all you are to remove in curing. But what would we think of his wisdom and goodness if he has shrouded? Shrouded means covered. If he had shrouded in mysterious obscurity that which was to be cured in diseases, and shut it up in the hidden interior, and thus rendered it impossible for man to know the malady accurately, consequently impossible for him to cure it. So he is saying ultimately that it is the uh, blessing of the God that he told us that what is to be cured, that is signs and symptoms. If suppose God would have covered it, the signs and symptoms also, somewhere in the interior, even that is not expressed, means this window is closed, never open. What would happen? Would we be able to cure somebody? It was impossible for us. So we all must be very, very thankful to this blessings of the God. This is how Hahnemann is expressing whatever he knows, he is teaching us, but then he is not in any way boosting his discovery. This is the best part of Master Hahnemann. Very, very surprising and very, very impressive the way he writes, expresses himself, not only writes. So ultimately, we learned in this aphorism, if we simply recap it, that so far we understood the complete operation of the cure. How does it take place in Aphorism 16? In 17, he says, what is the role of the physician? What is the task for the physician? The task for the physician is to understand the totality, remove the totality, and when you are able to understand and remove the totality with the intelligent remedy, the rest of the job means the ultimate complete operation of the cure takes place by default. And by this way, your outcome is what? Your outcome is that you achieved the mission. And what is your mission? What is the mission of the physician? You know it well, the cure. And you are not doing one wrong thing, that which is not my mission, that you are not really uh, unnecessarily sounding uh, too much of wisdom, which is actually not a wisdom but the childish talk. And in the two footnotes. In the first footnote, he tells about the moral remedy. That means that how the influence of the thought make us sick, even to the level of producing signs of death. At the same time, if you are able to generate another thought against it so that it is being removed, earlier thought of death removed, and you come to know how health restores back. If there are external signs and symptoms of the death is coming, it cannot come without the internal changes. And when you just stand another thought against it, which is going to cure it as an indicated remedy, again, those expressed signs and symptoms of the death will go away. At the same time, the internal disturbance, which is indicating towards the signs of death, will also fade off. So we also learn out of it where is something materialistic in the disease. It is not. And in the second footnote, he says that you should be very, very thankful to the merciful of God that He has given one window from which we can see, we can perceive signs and symptoms, and we can find out the totality of the disease. If God would have covered this also, the cure must be impossible. So, this is all something we come to know about the aphorism 17. Now, are you having any questions regarding aphorism 17? Or if you are having any question regarding aphorism 9 to 17, we can take up now your questions. We have some time with us, some 10 minutes. So, in this 10 minutes, I wish if you have some questions, we can discuss your questions. So just write me immediately in the live chat if you have certain questions so that we can take up those questions and make some more clarifications regarding your thoughts about it. I am just trying to be very slow in this regard, learning these aphorisms because it is it is a subject related to this dynamics and all. When when we are not really very oriented about it, we we are unable to relate this dynamicity with the studies of the physics where so much of dynamic topics are discussed. We are unable to relate this dynamic concept with so much of dynamic topics we all studied in the chemistry. And if we really try to understand that when dynamicity can be in physics, when dynamicity can be in chemistry, it can be in biology also. And finally, it can be in art of medicine also. We are so much disoriented. We are so much influenced with the uh, materialistic concept of the disease in the art of medicine and in the biology that for us it cannot be. How does it matter if we don't give too much of value of dynamicity to the physics and chemistry? Only that some of the comfort of the daily living may be missing. It is the concept of dynamicity which has given so much of comfort in our daily living. You must be having the washing machine in your home, which if you start, it will complete the job and stop by itself. You just make it ready, and sleep. Rest of the job is by machine only. Is it not the dynamicity? It is the dynamicity of the physics which made our life so comfortable. If in the physics the concept of dynamicity can give so much of comfort in our life, don't you think that the concept of dynamicity is going to give so much of comfort the one who are suffering with the diseases? So we got one comment, Dr. Gifty Kaur. Sir, excessive sleep, lack of appetite are also symptoms of depression or some psychological disease beside death. See, when you get such symptoms, and what is that depression? Depression is something related to the feeling of living. When you say depression, you find along with all these symptoms that I am not finding that pleasure in living. That is why in depression people commit suicide, right? So when you talk diagnosis of depression, in that the loathing of life, that you are not really very keen to live, not happy, you're not having any pleasure of living. That is what the depression is. Dr. Shab, in case of superstitious fancy, sometimes it is difficult to cure the case. I agree with you. There are many failures for that. But then I must tell you that we are to learn, we are to be, before any kind of physician, before going to be a physician, we have to become a observer. We have to be an observer, medical observer. I discussed the whole article for that purpose. That we should be observing all these things, and we should be quite creative enough to immediately stand up another thought against that superstitious. Like sometime it happens that some Guruji told that this is going to happen. Sometimes they do the prediction, some Gurujis. There are two ways. Either you are to get a thought to remove this thought, or the next deception can be you create an atmosphere to finally make this man, influenced man, understand, yes, you died, now you're in heaven. We have one picture of the heaven. You create that very imagination of the heaven, and you just prove him in such a beautiful deception, as we see in the Bollywood movies and the Hollywood movies, that they would create such a fancy against that thought that you're going to die. There are only one thing, that no, you're not going to die. There's one thought, or another thought can be, all right, you just complete his wish that you're died. And you create those circumstances that you died and you are in heaven now. Once that thought is exhausted, it will be removed. Or you just remove that thought as a some kind of all-pin in your mind, and you remove that pin from the mind. So Pooja Pal, sir, please give more examples how to apply moral remedy concept in day-to-day practice, and how to differentiate when there is a requirement of moral remedy for the patient. Like, all patients, they really need this. See, somebody is so much grieved in the family because there are so many fights in the family. Lot of many fights. My mother-in-law is not good. My husband is very, very angry. All those very common issues we face across in our day-to-day life and in clinical practice. You must be ready with the examples that there are certain more cases which are much worse than his. And you tell him that story, that another patient coming to and the husband is so rascal that beats the wife every day, morning, evening. There are people. I'm not saying quote wrong cases. Even if for the purpose of moral remedy, all those deceptions can be done. Means you can tell the jhuta case also. You can tell the lies also. The purpose is honest. But I would say we get such cases we can quote. When you see I am in some misery, I see somebody else bigger misery, I get healed. It's a moral remedy, most common. And there are many, many more examples. You can yourself judge and find out. Hema says how to deal with such superstitious person. Sometimes they are not ready to take our medicine. What to do then? First of all, don't pissed off as a physician. I get there are so many some patients with me or with you also. One patient I reminded with your example, with your question, Hema, that one lady, she's some 40, 45 years, she has a belief that the because maybe some reason her husband told her once that my whole business runs so well because you do so much of religious activities and pujas and all. And now at the moment she's suffering with the second stage CRF. Her creatinine remains some 2 or above than 2 like this. And she is into so much of habit that waking up in the early morning 4 and doing so many long pujas and so many things she's been doing, uh, even you can't imagine. So I told her once, initial when she started seeing me for the treatment, that you have to stop all this. So she was in that belief, she was in that point of view, she was of that opinion that I will stop the medication, but I will not stop all this. So I agree with the here Dr. Hema that it is sometimes quite difficult. But one thing, the one who is superstitious about something, maybe for example in this case I'm telling, somebody should be mostly people are superstitious about the religion, their religion, and at the same time we cannot really question the religious belief of somebody. All right, with the due regard and respect to the other person's religious beliefs, until and otherwise you have a thorough knowledge of the religion, whatever the patient, his religion, his all activities of the religious purposes, if you are not very thorough about it, you cannot handle her superstition. So this is the job for us, that we must be very well aware about the culture of the patient, of who's seeing us, and also about his religion, the patient who is seeing us. If you know those things in detail, you can really make the person convinced. Since I'm a student of, apart from homeopathy, Ognon, I'm a student of psychology. I read a lot of religion, including the Hindu religion, so many books and all. So when I found that that simple admonition, don't do this, will not help. So I started discussing with her the religion. And slowly, she agreed to the point that that yes, I am going to be going to obey you. Now she is able to accept myself. Some half of the things she is able to accept me. So because she understood that I am nonetheless, means everybody is getting some or the other knowledge from the some gurujis and all. But then because when she judged that I am also of so much of the understanding about the religion, she started understanding my point. And somehow, after so many of discussions, some longer time I took, she agreed to my point that so much of optimism towards the religious activities are going to be harmful to her health. Now she subdued her activities, and along with that, where such superstitious people are not buzzing to her advice, what does it mean? It means it is quite miasmatic in the origin. Give your indicated medicine along with the consideration of the miasm. That will also help you to subdue the patient in that regard. So that is how we are going to get all these things. Uh, I believe my point is clear. All these points what we discussed, they they will be coming again when we are going to discuss the practical part. So we will be continuing much more details with the examples of the cases when we are going in the practical part of it. So uh, we are just one aphorism away to complete this concept. We will be catching up tomorrow and completing the whole concept of this dynamic understanding of health, disease, and cure. Till then, uh, I just say take care of every one of you, your family, your patients. Uh, the threat of the COVID 19 is still there. So, hoping for the best for everyone. I sign off. Thank you, everyone. Thank you so much.